First-year resident at the New Hampshire Dartmouth Family Medicine Residency Program at Concord Hospital. I am here to show you a day in the life of an intern, ICU edition. Today is Wednesday around 1 o'clock. I just got back from Continuity Clinic out in Hillsborough where I saw 4 patients. Let's see. I have education block next. It is beautiful outside, so I'm thinking of grabbing my laptop and actually doing it outside. Today we're discussing medical marijuana, and I actually don't remember the other topics after that, but that should be a fruitful discussion. We're also having some sort of residency update meeting. Let's see, last week we talked about upper respiratory tract infections and when not to use antibiotics for part of the treatment regimen. So yeah, I'm excited about Ed Block. I'll take you into the ICU tomorrow and try and show you guys as much as I can about a day in my life. For now, I'm gonna go prep a lunch. What I'm gonna eat is to be determined. It's probably gonna be leftovers from last night, but I don't remember what that was. Probably gonna be a bagel involved. Good morning. It is about 6:30 on Friday morning. I'm about to head into the ICU. I'm here a little bit early. I need coffee and I need to calm myself down before I give a presentation in front of the pulmonary and ICU attendings and the rest of the team. I'm talking about the art of antiretroviral therapy in ICU patients that are HIV infected. And the bottom line is you should continue the therapy unless they have cryptococcal meningitis. So I'm just gonna go in, get my thoughts together, change into some scrubs, and I'll see you guys soon. We just finished morning sign out. I gave my presentation on antiretroviral therapy and critically ill HIV positive patients. My attendings gave me some really positive feedback, so I was very happy about that. I was extremely nervous just because, you know, here you are sitting lecturing about a critical care topic in front of a bunch of critical care physicians, but it was really fun to research the topic. I am outside of one of our hospital's coffee shops, Carner Blue. It's got Starbucks coffee, but it also has really good food. I'm gonna grab some caffeine and then get to rounding and writing notes on my 2 patients. See you guys I wanted to give you guys a tour of a wing in the ICU. We have nurses station where the nurses sit a nurse sitting at the station would have the room behind her or him and the room next to them. There is a fishbowl where providers or nurses can sit and document. I see a lot of consultants go there and do their notes. It's also my favorite place to sit. Inside we have bed, recliner, name board. This one's got a window, but it is sort of obstructed because it's got some sort of, I don't know, air vacuum system to help with COVID stuff. It is 10 o'clock and I am waiting for rounds to start. They start at 10 o'clock every day, usually last around an hour, depending on who the provider is and how many people we have in the unit. Usually during rounds we hop as an interdisciplinary team of about 8 people from room to room in the unit, and the nurses for the patients are actually the ones that usually present on rounds. As residents on our ICU rotation, it's expected that we are the ones that present the patient on rounds, so the nurses do appreciate the little break from what I gleaned. Rounds will start at 10, and they will be attended by a nutritionist or dietitian, respiratory therapist, several nursing supervisors, managers, the attending physician, of course, me, the peon, and any sort of consulting physicians or the primary team if we're the ones consulted who want to participate or listen in rounds. So usually it's a group of about 6 or 8 people, which can be intimidating in terms of presentation, but I find that having that many eyes and ears on a patient, nothing is missed. Everything from the, how many drops of urine we should be targeting to how many drops of nutrition they're getting fed. I mean, everything is accounted for. It's incredible to see all of these kind of disjointed pieces come together and create a complete picture of patient care. It's something that I haven't really seen before on any of my medical school rotations, and it's really exciting to be a part of. So people are starting to filter in for rounds, so I will see you guys in a little bit. After rounds are done, I'll finish up my notes on these 2 patients, and then I will get some lunch. Num num. ICU conference room right now. It is 1 o'clock. Just grabbed lunch from the cafeteria. Kombucha must have for me. From 1 to 2, or actually the time kind of varies. On most days for ICU rotation, one of my attendings takes an hour to an hour and a half out of his day to do dedicated teaching and lectures. It's one-on-one. I've had lectures on shock, ventilator settings, the ICU basics that I definitely didn't have a strong foundation in. Today I get to choose the topic, so I'm hoping to talk about patient positioning on ventilators. One of my patients went prone last night in an attempt to help with oxygenation. And so I want to understand a little bit more about the physiology behind it. So hopefully that's what I'll talk about. Reporting live from the green space in the ICU. I just finished up my documentation for my 2 ICU patients, and my attending signed off, so I was just reading his addendum. I also finished my clinic notes for my 2 patients that I saw yesterday that I needed to just tidy up. So now I'm taking a little bit of a breather. It's around 3 o'clock. I'm getting myself kind of in a good mental headspace because I have the husband of a patient coming in, and we're about to have a pretty difficult conversation about goals of care and the status of the patient and her poor prognosis. So I'm just, trying to get myself in a good spot for that mentally. I will probably not be driving the conversation. I anticipate that my attending will, but I would like to be present for it. I made it clear at the beginning of my ICU rotation that I have an interest in hospice and palliative care, and so the ICU attendings have been really good about trying to get me to participate in a lot of these family meetings. They've offered to let me, drive the bus on some of them, which is intimidating, but a really good opportunity. So yeah, I'm looking forward to that, as weird as it sounds. After that family meeting, we will probably just do a quick lap around the ICU. It will be the ICU advanced practitioners, the daytime attending, the nighttime attending who's coming on, and then the little old me. Usually respiratory therapy comes along too, to give updates about patients' ventilator settings and things like that. So that'll probably happen after this family meeting. It usually happens at 4:30. And what's nice is if there's no more work to be done or no procedures coming up, then usually the attending lets you go home after that. So I was watching a lot of vlogs to prepare for this because I didn't really know what they entailed, and I saw that a lot of vloggers vlog from their car, and I don't know if it's legal. It's certainly distracting, so I'll keep it short. It's 7 o'clock. I just left the ICU. This is the latest day I've actually spent on the unit. We had a couple of patients come down in the afternoon from the floors that needed pretty urgent evaluation, so that tied us up. And then one of my 2 patients today ended up needing an emergent chest tube placed for a pneumothorax. And so that had to be done pretty much right as I was getting ready to leave. My attending performed the procedure because I did not feel as if these fumbling hands would be confident enough to do an emergent chest tube with someone's oxygen saturations actively dropping. But I have been able to do a couple of procedures on this rotation. I did a central line, I think my second day, which was very intimidating, but very cool. Let's see, I got to do a couple diagnostic paracenteses. I watched a lot of chest tube placements. I got to watch some bronchoscopies and even drive the camera for a little. I'm terrible at video games, so I did not do very well in that, but it was a cool experience nonetheless. And then during this rotation, I also got the opportunity to go into the simulation lab with the same attending that does the 1-hour lectures. And we did some intubation and peripheral venous access practice on dummies. So that was a cool opportunity. It kind of made me feel as if I was pretty competent in those skills, even though I didn't do that many of them on live patients. But ICU rotation is good for getting to do some hands-on procedures. I noticed that not only are attendings willing to kind of loop you into procedures, but I also had a couple of nurses who would just see me sitting in the fishbowl writing my notes. They would pull me into a room and say, "Hey, have you ever removed an IO?" And I would say no, and they'd say, "All right, put your gloves on." So everybody is just so invested in your learning. I mean, I even had nurses explain to me things like how to hang an IV and connect it to the pump. Things that doctors, I feel like, should know but don't know. Reasons why we need our amazing nurses. I have a colleague. She happens to be a second-year resident. I'm not going to name any names, Megan Bennett. But she always makes fun of me for being a Dunkies gal. But what can I say? It's the New Englander in me.